So we don't even have a fraction of the amount of time for me to cover what's out there, but just a sampling there are a number of different websites that you can visit, some that are more patient-driven, some that are medical profession focused. There are videos. YouTube has a collection of videos from different organizations who have their own channels. There are apps and games, some that you can create an account and you can interact with people and it can give you some motivation in that connection. You can also do it without interacting with other people. There's that option as well. There's also social media and a number of apps that have been developed as a product of research. So a big concern that all of us have is the effect that these resources may have on our relationship with our healthcare provider. Now, on the one hand, it helps you come really, really prepared for your appointment. You're going to get the most out of it, which can be a very, very positive thing. And also, it can take a little bit away from that very authoritative physician perception that a lot of people have, and it can sort of just change the power balance and put you on a little bit more equal footing. But a big concern that people have is that this might make your physician perceive you as being too pushy or too needy. So a lot of it comes down to the delivery and being respectful in how you bring these up to your healthcare providers. Now, as I just said, it's all about the technique. Now, 2 or 3 tips for success, 2 that I'm going to talk about right here due to time. Ask people who have more experience in what resources you should use. There are some good and some bad. And also make sure that you're extremely aware of your circumstance. People with arthritis know that the symptoms can get worse when you're in a flare, or they can be a little bit better. And personally, I'm a lot more willing to believe a less credible source when I'm feeling worse. So if I'm going to read something online that says that avocados cure lupus, and I'm in the middle of a flare, I'm going to run to Safeway. Conversely, if I'm feeling a little bit better, I might be slightly more rational. So that's from true experience.
I didn't know about avocados curing lupus. Thank you. Other tips that we would like to share with you for potential success with this is think about the trustworthiness of the source. So you have many different places that you're accessing this information. So first of all, who wrote it? We can use the internet to find out some information about the person who wrote it. Is it somebody that comes from a reputable institution of research, such as the Arthritis Research Center or from Cochrane Collaboration? Or is it from the Institute of the National Enquirer? If it's from the Institute of the National Enquirer, there might be a little suspicion of doubt there. Take a look at who funded it. If it's funded by a pharmaceutical company or a device company that has an interest in you believing this information and buying these products, that should affect a little bit the credibility of the information. And finally, think about what kind of information it is. If it looks like it's something that's written purely about opinion, that's a little less powerful than something which is from a research base. Is it a research article? Was it written about a single patient? Was it written about multiple patients? Were, 5 patients interviewed, or were 500 patients interviewed? Were 5 patients a part of the study, or were 500 a part of the study? And then when they combine studies together, such as articles written by the Cochrane Collaboration, where they bring together lots and lots of papers all together, that improves the credibility of the resource. So what is your experience? Paper, thank you, that was my little warning that time is winding up here. There was a paper written recently where they interviewed patients about their experiences with accessing information on the internet. And, it was both sides of the equation. For some situations, and it's certainly my experience, when I access information, at times I have felt like I've had more fear from that information. At times I felt like I've had less fear because of it. Sometimes I feel more confused or disappointed. Sometimes I feel, wow, now I really have a good understanding of this. Sometimes I felt like the village idiot. I felt very inadequate from accessing that. I wish I had known that before. And sometimes I felt very empowered. And with practice of learning these different resources and speaking, the key for me is being able to take this information to my healthcare providers and saying, this is what I've found. Can you help me to interpret this? Do I have the right impression? So it's really getting that information back from them. So when we put it all together, well, I think of e-health kind of like a lot of things in life. It's like chocolate and it's like red wine. That you can make some bad choices that you feel not so great about the next day. Or you can learn through experience, a little bit of trial and error, and learning from collecting other information and then getting confirmation from others, you can make some choices that make you feel pretty darn good. So that's it.